So one of the main challenges right now in the area of risk assessments in health, I think, is that there are so many different processes. So people are using different processes for doing risk assessments for trade in animals, for example, based on the OIE guidance. There are risk assessment processes for chemicals in food, for example. And also, there are some for prediction of where a disease may emerge. For infectious diseases, there's also different outcomes, and the different processes are used for different objectives for different risk assessments, to develop targeted surveillance, to determine preparedness or management or communication options. And because historically the human health sector and the animal health sector have had very different reasons for doing risk assessment, the processes that the human health sector and the animal health sector have developed and evolved have been quite different. And now coming together to do assessments together, there are just some differences in processes. There are differences in terminology, how we use the words. We use the same words, but sometimes we mean different things, and that can be confusing. In most cases, we have the same objectives. We have the same ideas on what risk assessment means, but we are still working to figure out what are the steps, the crucial steps, and how can we compromise so that we can come out with a single process that we both agree on. Another thing that we very much agree on, however, is that there actually have to be 3 risk assessments for every zoonotic event. Because public health interests vary very differently, significantly from animal health interests in many cases, the number of hospital beds you need for an avian influenza outbreak or a pandemic is a question animal health really can't help us with. And animal health may be very interested in trade barriers and what is the risk to trade from some particular hazard. And those things are different, and we may need different processes to assess those different risks from the human health sector and the animal health sector. But there's a place in the middle. There are risk questions in management and communication in the middle that we really need to do together. And so we need to develop processes, a joint process where we can agree on the terminology and the steps and the outcome for those issues at the human-animal interface.